I began in 1985 then working for the hospital as the director of this unit, and in 1987 or 88, I can't remember which, I also became chief psychologist for the hospital. And I guess one of the things that drew me here was the fact that I saw the place being very innovative at the time, and we're talking the 70s, 80s, and also I saw it as being a very familial sort of place in terms of it was very much a team concept on each treatment team for each group of patients. We had a full range of professionals from psychiatry, psychology, social work, physiotherapy, occupational therapy, recreation. It was just social work. It was a real, we even had dietary consultants. The hospital at the time provided a real home for the patients who were here. And for example, primary nursing came in while I was here, where one nurse on each unit was responsible for a particular patient and was communicating with the patient's family, oftentimes became very close friends with that family for the length of time that the patient was here. He or she, the nurse that is, would be able to coordinate knowing everything that was going on with the psychologist, with the psychiatrist, with the social worker, with whoever, and present a unified picture, an intelligent picture to the family and to the patient. We had services like, for example, we had a workshop. Recreation was terribly important here in terms of patient development, not just in terms of having a good time. But we had a workshop here that my patients, the developmentally handicapped patients, went to, and for them it was getting up for work. You know, they had a reason to get up. They felt important. They felt like they were accomplishing something. We had fishing trips. We took them all kinds of places to make it more normal. I remember one time we took a group of my patients to Storybook Gardens in London. We were up in Springbank Park. And one of the guys, his name was John. I was standing next to him. We were by this display, or a caged-in area with animals in it, and there was a plaque up on the wall, and on the fence, and it said, this was donated by so-and-so, and yada, yada, yada. And this guy standing next to me, he's developmentally late, and he reads it. He reads it aloud to me, just because he's thinking out loud. Well, I had no idea he could read, and I remember from that time on, once a month, I would take him to the St. Thomas Library. We got him a library card and things like that. He really enjoyed that, and that's just one story of many. We had carnivals here for the entire hospital, and our unit had a carnival at least twice in the summer for our unit alone. We would bring people down from London. There was a troupe called Laugh Guard, who were a bunch of comics and clowns and magicians. We'd bring them down, and the patients would spend the day watching them, barbecuing. It was just really a very home-like atmosphere. But it was certainly very beneficial for the patients.